Quality Improvement Scanning Compliance by Jennifer Walker, United States University. This week, my name was on the naughty list. My barcode scanning rate dropped to 57% in May. In all my years of nursing, I have never bypassed this safety feature. Nurses strive to provide safe, evidence-based practice to everyone. My rate of scanning dismayed me. With careful reflection, I've identified the two main reasons as time restraints and malfunctioning scanners. To be honest, the reasons blend. I got tired of trying multiple times to get the scanner to work unsuccessfully. I finally just gave up and started manually verifying the patient and the medication. I don't want to be unsafe. The research found barcode medication administration, Bcma, reportedly can reduce medication errors by over 90%. A medication error is an error whether there is harm to the patient or not. This presentation is to help emergency department nursing staff remember scanning is best practice. Nurses are the last line of defense a patient has against medication errors. D'Souza states a medication error is defined as any avoidable event that can bring complications to patients. And when such errors do not cause damages, their occurrences indicate a low level of safety in healthcare. It is unacceptable that so many still occur. The Joint Commission reports 7,000 deaths happen a year due to medication administration errors. Medication error prevention is one of the annual national safety goals. Hospitals implement multiple interventional steps that intercept errors before the medication is administered. Bcma is a crucial step in the interventional process. At times, it becomes essential to remember why we have the Bcma process. There are often times when ED nurses find themselves in an emergency where they need to get things done immediately. Barcode scanning takes some time and involves multiple steps. High stress environment, absence of vital information, or decreased ability to quickly access patient history during an emergency treatment are numerous factors that increase medication errors in an emergency department. During an emergency, ED nurses tend to skip steps that are in place for safety. No matter how time-consuming scanning may feel, it catches errors. With a possible 90% error reduction, it is vital that ED nurses not make skipping steps part of their regular practice. There is a saying that doctors abide by the Hippocratic Oath, primum non nocere. First, do no harm. Mortel states nurses abide by an equivalent oath, referred to as the Nightingale Pledge, which acts to remind them of their responsibilities to the patient, and in part states that nurses will not administer any harmful drug. The wrong dosage is considered a harmful drug. The wrong route is deemed to be harmful. Using the barcode scanning method eliminates the chance of giving the wrong medication to the wrong patient. If a nurse reads the directions in the EMR, the right dose and route are known. It is easy to see how errors are significantly reduced by Bcma. I challenge you as an ED nurse to think of it this way. If I was your baby's nurse, would you want me to scan your baby and the medication before administration? As nurses, we are aware of what is right and what is wrong. Over the years, the 5 rights of medication administration continue to evolve into extra rights. The core rights remain the same. Right route, right drug, right time, right dose, and right patient. Barcode medication administration helps ensure all these rights are followed. We save lives on a daily basis. Do what is right and follow the evidence. Use barcode medication administration.